Welcome to Organic Awakening. Did you know your feet hold valuable secrets about your health? Most of us tend to overlook them, but our feet can unveil hidden issues in our liver, thyroid, and much more. In today's video, we'll dive into the 10 crucial signals your feet are sending you, and I'll share natural and effective solutions you can start using right away to address these symptoms, at least until you can consult your doctor. This information could be the first step in transforming your health from your feet all the way up to your head. So let's awaken our awareness and discover what our feet have to tell us. Stay tuned. First, swollen feet. If you constantly notice swollen feet, it could be a sign of poor circulation, possibly due to varicose veins. However, chronic liver diseases such as fatty liver and cirrhosis can also cause fluid retention, leading to swelling in the feet and ankles. This happens because the liver, when diseased, struggles to process proteins and fluids. Swollen feet can also indicate hidden heart or kidney problems. Occasional swelling, especially after standing for long periods or sitting in the same position, is normal, but if it persists or worsens, you should consult a doctor. To temporarily relieve these symptoms, elevate your legs when resting to improve venous blood return, wear elastic or compression stockings, and walk daily to activate blood circulation. Avoid wearing tight clothing around the waist, and reduce your intake of table salt and sodium, which contribute to fluid retention. Staying hydrated and consuming foods rich in potassium and magnesium, such as guava, kiwi, watermelon, and banana, can also help. However, if you have advanced kidney issues, be cautious with potassium-rich foods. Second, brown or reddish spots on the feet. Dark brown or reddish spots on the lower legs or feet that don't fade when rubbed may indicate a condition called ochre dermatitis, often caused by chronic venous insufficiency, varicose veins. Even if varicose veins are not visible, the pooling of blood due to malfunctioning valves in the leg veins can lead to these skin changes. This condition can eventually result in ulcers, scarring, or itching-related injuries. Ochre dermatitis can also signal hidden issues with the heart, kidneys, or liver, so it's important to consult a doctor. In addition to walking daily, wearing compression stockings, and consuming diuretic foods, try elevating your legs against a wall for at least 20 minutes a day to relieve swelling and improve venous and lymphatic return. Third, thick, yellow, and brittle toenails. Thick, yellow, and brittle toenails are usually a sign of a fungal infection known as onychomycosis. If untreated, the infection can spread and cause more serious discomfort. Although this issue may seem superficial, fungal nails can also point to underlying health problems like prediabetes, diabetes, or liver issues. A compromised liver may weaken the immune system, making infections more likely, including nail fungus. People with diabetes need to be especially cautious, as they are at a higher risk of complications from such infections. To treat nail fungus naturally, keep your nails clean and dry, and file them gently each night to improve the effectiveness of topical treatments. One effective remedy is the use of Vicks VapoRub, which contains menthol and eucalyptus. Although it may take weeks to see results, using this remedy daily can reduce nail fungus, especially when the infection affects less than half of the nail. However, to ensure lasting results, it's essential to address any underlying issues, such as diabetes or liver disease. Intense itching in the feet, especially between the toes and accompanied by peeling, can be a sign of a candida fungus infection mixed with other microorganisms. This often occurs when the feet are too wet or lack proper ventilation. The infection not only causes redness, itching, and peeling, but can also be a warning sign of diabetes or liver problems. Both conditions can weaken the immune system, making infections like candida more likely. Fortunately, there are natural remedies to combat this. It's essential to keep your feet dry and well ventilated by wearing cotton socks that allow for perspiration and regularly changing shoes. As a natural treatment, you can soak your feet in a liter of water mixed with a teaspoon of vinegar for 20 to 30 minutes. Applying coconut oil before bed on your feet and between your toes is also effective, as the oil has natural antifungal properties that can relieve symptoms and irritation, at least temporarily. However, persistent itching and peeling should not be ignored. If the problem persists, consult your doctor to rule out any underlying health issues. If your feet constantly feel cold, this may be more than just a temperature problem. While cold feet are often associated with circulation issues, it can also be a sign of hypothyroidism, a condition where the thyroid gland doesn't produce enough hormones to keep the metabolism functioning properly. This slows down many bodily processes, including temperature regulation, which can leave you with cold feet. In cases of severe liver disease, such as advanced stage fatty liver, inflammation, or cirrhosis, circulation issues may also cause intense coldness in the extremities. When should you suspect liver or thyroid problems? If you experience persistent fatigue, unexplained weight gain, dry skin, and cold hands and feet, you may have a thyroid issue. If you also notice yellowish skin and eyes, pain below the ribs on the right side, darker urine, and unexplained weight loss, the problem could be related to the liver. To temporarily improve the temperature in your feet and hands, wearing thermal socks and doing exercises that promote circulation, such as walking or raising your legs against the wall, can help. Additionally, incorporating antioxidant-rich foods and good fats like sea fish, nuts, seeds, and extra virgin olive oil into your diet can support the health of both your thyroid and liver. Night cramps in feet and legs. Night cramps are those painful spasms or cramps that occur suddenly while you are resting or sleeping. They are truly horrible, although they often occur due to muscle fatigue after performing very intense exercise, dehydration from drinking little water, or from spending a long time without moving. Cramps can also signal deeper problems in the body, especially when they are persistent, very intense, and occur every day. The lack of electrolytes such as potassium and magnesium is one of the main causes of these discomforts, since these minerals are crucial for good contraction and relaxation of your muscles. However, cramps may also indicate a hidden kidney or liver problem. When any of these organs do not function properly, our body has great difficulty processing toxins, minerals such as potassium and magnesium, and eliminating waste. All of this can trigger cramps, especially at night when our circulation slows down. That's why I want to give you 3 natural solutions for cramps. First of all, when they are persistent, you must attack the problem from the root. For that, you must discover if there is a problem in any of your internal organs. Get yourself checked. Second, drink green juices every day. They are very rich in minerals such as potassium and magnesium and help eliminate toxins. You can make it with celery, spinach, peeled apple, and ginger to give it an antioxidant touch. You can also drink water with lemon every day, ideally when you wake up. However, if you have advanced stage kidney problems, it is crucial that you consult a doctor to ensure you are not accumulating minerals in your body. Third, like other effective solutions to improve cramps, perform exercises such as stretching your feet and legs before going to bed, keeping your muscles active with daily walks, and ensuring you are well hydrated. Drink water until your urine is clear. Numbness and tingling in the feet. Be very careful with numbness and tingling in the feet. That sensation can happen to everyone from time to time, and it may be normal, but when it is persistent or very intense, something may be happening in your body. So if you feel it every day, you should think about circulation problems, compressed nerves or neuropathy, diabetes, and even a deficiency of essential vitamins like vitamin B12. I want to give you a big warning because even liver or kidney problems can cause these discomforts by causing the accumulation of toxins that damage our nerves. But when should we worry? And what natural solutions exist? First, if this sensation occurs all the time, especially accompanied by pain, swelling, changes in skin color, or any of the other symptoms I mentioned, you should consult your doctor, as they may be early signs of more serious conditions. If detected in time, you can even reverse them. Now, as temporary solutions and for symptom relief, I recommend 4 things. First, stretching and mobility exercises. If you spend a lot of time sitting in the same position, move your feet regularly to improve blood flow. This also helps to release nerves that may become trapped by swelling in our legs. You can stretch your calves and make circular movements with your foot. All of this greatly improves venous return and reduces numbness. Second, you can take supplements if you suspect you have a vitamin B12 deficiency. Increase your consumption of dairy products, eggs, meat, fish, or take a vitamin B12 supplement, but always under medical supervision. Make sure to deworm at least once a year, you, your family, and also your pets, because you may have parasites that are stealing your vitamins and causing these discomforts. This issue often goes unnoticed even by the best doctors. Another very important supplement is magnesium threonate, which helps relieve tingling and numbness, but it is important that a doctor prescribes it to you. Tip number 3 is to improve your circulation. You can do this by raising your feet against the wall for 20 minutes a day, as we mentioned before, or simply by walking, even inside your house. It is also very useful to eat a diet rich in antioxidants and good fats, such as extra virgin olive oil and sea fish. Number 4. If the tingling or numbness is caused by nerve compression, avoid crossing your legs, wearing very tight shoes, and high heels if you are a woman. Avoiding these can relieve pressure and nerve damage. Thin and shiny skin. I have shown you 7 signs on your feet that can indicate hidden problems in other parts of the body and how to recognize them in time. But now pay close attention, because I am going to reveal 3 other signs that are equally important but much more subtle, which can go unnoticed even by health professionals. Although these signs are not so obvious, they are key to detecting serious health problems in time. In position 8, very thin and shiny skin on the lower leg and feet may not just be an aesthetic problem. This sign may indicate that not enough blood with nutrients is reaching your extremities, which may indicate poor circulation. Without nutrients, the skin begins to lose elasticity and becomes thinner and shinier. This should raise suspicion about clogged arteries. In medicine, this is called peripheral artery disease. But even damaged nerves, diabetes or liver problems can also cause this. Pay attention to number 9. Little hair on the legs. If you notice that the hair on your feet and legs is drastically decreasing or disappearing in recent months, it can also be a sign that something is not right and could indicate the same problems mentioned earlier. These ailments affect millions of people without them knowing it. And the most worrying thing is that they are often ignored even by health professionals. Sign number 10 is having dry and cracked heels and soles of your feet. Everyone believes this is a simple hydration problem, but in some cases, it can be associated with thyroid hormonal problems, diabetes, even years before they are discovered. It can also be related to a lack of vitamins or digestive problems that prevent the absorption of some nutrients. Be very careful to solve this. At least temporarily, you can apply urea creams or creams rich in vitamin E on the soles of your feet and on your heels. However, I suggest you do not ignore this sign and consult your doctor for a checkup to see what's going on inside. At the same time, you can increase the consumption of foods rich in omega-3 or take supplements. Natural sources of this nutrient include chia seeds, flaxseed, extra virgin olive oil, and sea fish. All of this improves the health of our skin from within.